Soon after the coronavirus national emergency declaration, the state of Florida was the first state to submit and receive a Section 1135 waiver. This type of waiver allows flexibility in the state's Medicaid program. It can only be granted if there is both a public health emergency and a national emergency. And we have both of those right now. Soon after Florida submitted its waiver, the state of Washington followed suit. As of March 23rd, an additional 11 states have submitted and received approval from the Centers for Medicare and Medicaid Services to implement their flexibility in their state Medicaid programs. This is only 10 days after the national emergency declaration, so these states moved quickly, and so did CMS. The flexibility that is granted to these states, and it looks a little different for each one, but it's following some general guidelines of streamlined provider enrollment processes, reimbursing out-of-state providers, waiving prior authorization requirements, suspending certain nursing home screening requirements, and extending deadlines for things like appeals and state fair hearing requests. Now, waivers are effective from March 1st, 2020 for the duration of the emergency. Now, this is only 13 states that have asked permission, but we know many other states are working on these waivers in the meantime. They will be submitting them to the Centers for Medicare and Medicaid Services in the weeks, probably days ahead. The Centers for Medicare and Medicaid Services has created a new website. They're calling it their Current Emergencies website, where they are tracking the states that are asking for Medicaid flexibility, the approval letters, and also guidance to other states with templates of how their waiver can look when it's submitted. The site where the letters are actually posted once they're approved is also shared in the description below.